Hi, everyone. I hope everyone is having a wonderful time in the conference so far. I'm so sad that I'm not able to be there with you guys in person. For those of you I haven't met, my name is Jeff D'Angelo. My son JJ was diagnosed with CHAMP1 about 7 years ago. Like many of you, that was very overwhelming news, life changing, and likely one of the hardest moments of my life. Um, at the time of his diagnosis, there was little information that existed outside of our CHAMP1 support group. From that moment on, it's been my wife and I's mission to do the best we can to impact CHAMP1 kids' lives. And that starts with faster diagnosis, everything in between, and ultimately a treatment in the clinic. Um, Early on for me, this was a very isolating journey and very frustrating. And it's really incredible to see how far we've come as a community and how we've sort of united to accelerate change together. And I want to thank everybody, both in the European and American board, for all the amazing things you guys do to support Champ1. There's so many people to thank, and I just want to say that I'm honored to be a part of this mission with you. Daniel, thanks for all you do, man, and putting this conference together. I know it's not an easy job, but don't stress out. It's going to be amazing. I know it. Um, I want to just take an opportunity to go as quick as I can and just share with you some of the amazing. I'm setting a timer so I don't pass 10 minutes to share the amazing accomplishments that our foundations have been able to achieve. And I rarely take the time to enjoy this part of it. Primarily for me, it never feels like it's happened fast enough. But I think it is remarkable given the little resources we have in the organization to sort of make the impact that we had. And I do want to acknowledge um, there's a lot more to do, and it has to happen a lot faster if we do want to see this impact our generation of children. Our goal has been to put ourselves in the best position for when a treatment does become available, whether that's for CHAMP1 specifically or for rare disease broadly, that we're ready. And that means having the tools, the data, the scientific collaborations in place so researchers, biotech, and clinical teams can join both quickly and effectively. And we have built a brilliant network of researchers. A lot of them serve on our advisory committee and they help guide every strategy and move that we make. And among some of the most important accomplishments, sort of the building blocks of research are our data, our animal models, and our different cell lines through blood sampling. And you'll hear a lot about how these projects and some of these pieces were put together years ago, and they're now sort of reaping the benefits years later. For the families that are there, I know I'm talking quick, and I'm going to try to get through this. I just want to say to you guys, take a minute to realize that you're surrounded by people that understand what you're going through, and really enjoy being around other families. I hope you guys feel empowered to ask tons of questions. You don't have to be a scientist. Get involved, and just remember that you don't get any information. About patients without patients, there is no super team of people that are advocating for Champ1 behind the scenes. We're the team. It's the parents. It's the families, the ones that show up to this conference, the ones who share data, give samples, and don't start pushing and driving this forward. Um, I know that contributing to studies gets redundant. Trust me, I've done so many of them. Some of them are exhausting, but that's sort of what it takes. That's the key to better care, to clearer standards, and ultimately treatments. We have a registry called RareX. I don't know if everyone knows about it. I know Stephanie wasn't able to present on it in person. She's the head of patient registry. You could ask anyone in the foundation. Glad to help you, sign you up, and answer any questions you have. This information isn't just for the future. It's very relevant to now. We could pull surveys from RareX. You could take that information to doctor's appointments to help advocate for care. You can take that information to IEP or education meetings at school to help advocate for services. It is extremely relevant. And anytime we get an opportunity to work with a clinician, given the lack of available publications on Champ1, we have to, as a community, take advantage of it. Like the one with Dr. Zolino right now. Those interviews will yield to information that likely didn't exist. I'm going to really quickly just highlight a couple pieces so you guys understand the significance of it. To give you an example, we were able to work through Combined Brain, which is a consortium of rare diseases that we're a part of, and a genetic council at the University of Rutgers. We were able to get a rare disease concept paper for CHAMP1. And just to give you some of the things that it serves was one, it highlights the caregiver burden for our families that is often overlooked. It also highlights all of the symptoms that don't exist in literature that our patient or that our families report. So as I've sat here talking, I completely didn't even open my slides, so I'm gonna really quickly go through them and just kind of highlight a couple things. So in this study, it's actually in the process of going through publication. It will be open source to some platform like BioScript, so everybody will have open access to it at some point in the near future. But I just want to highlight that 71 of the symptoms that were reported by our families are not currently in literature. That's huge. Um, this study will serve as a guide for clinical endpoints for future trials. And as I mentioned before, it really does a good job of highlighting the caregiver burden. Another study that was just conducted, and again, will be on open source, or I believe on SAR. 15 families um, went through evaluations. They completed the vineyard, and this study was repeated for the second time. So Mount Sinai plans to do it a third time next year. And now we're getting a longitudinal picture of CHAMP1. The good news is our kids are progressing. It's clearly much slower than their peers, but the good news is that there's no sign of regression. Um, Mount Sinai, through this study, will serve as a very good candidate in the event we do have a clinical trial. They have sort of a mini natural history study that they're conducting there, and I want to tell you guys I really do believe that over the next couple years, it will be more of a common thing to see case studies and clinical trials for CHAMP1. I do think we're making that type of an impact, and we are starting to progress from basic research to translational. Okay, so the next and extremely important thing that we've been able to do and still doing, and I just want to highlight the impact of how some of this stuff took place 7 years ago, is now sort of um, we're now seeing the benefits and the use for it. So um, we had our first conferences in 2017, and that sort of served as a springboard for research. Um, we had samples given by I want to say 14 or 15 families, and at the time we didn't have any use for them. We didn't have the money to do anything with them, and we didn't have enough demand with researchers. So it kind of stayed in our biorepository. If I didn't mention, the Children's Hospital of Philadelphia was in attendance, helping with blood draws. Coriel was there. Someone from Coriel was represented, and they stayed in storage until we found partners. And Simon's Foundation, CHOP was able to give them aliquots of blood to make iPSC lines, which I'm sure you'll hear many times throughout this conference. They stand for induced pluripotent stem cells, and they take months to, if not a year or so, before they become available for use. So that was a huge milestone for our group. Some of the studies that you'll hear about over the course of the weekend. One of our heroes, Dr. Berto, his lab is working with these iPSC lines. There's a group at St. Jude Children's Hospital that has our cell lines. They're doing a proteomic study on organoids. Um, Yale University has our cell lines as well, and they're looking at the role of histone variants in CHAMP1. Dr. Durkin is at the conference presenting, and we're very excited to be able to work with him and to see his project sort of get off the ground running. Those cell lines are going to be used in his project. The samples from 2017 that were sitting in CHOP's biobank are used for Dr. Tartaglia's project for epigenetic signature. And the samples that you'll be giving this weekend will also go to further his research. So it's absolutely incredible that we've been able to find these partners, and by giving blood and samples now, these cell lines will be used for future projects as we find partners. Um, Last thing in terms of projects that are super important this weekend, we in the past collected plasma. We have a biotech company, again, through Combined Brain, that is partnering with us, and we had to collect 20. We weren't able to get 20 at the last conference. So we're pairing up with the samples donated at this conference to complete that project. So we'll have proteomics through St. Jude's, and we'll have proteomics done on our plasma, and that would be a great comparative study to be looked at into the future. Um, there's so many examples that I can continue to go off, but you get the point of how impactful it is and how important it is for to drive research forward. Um, as a parent, you need to have your child mutation represented. You don't know which opportunities are going to arise. You want to be in a position where research is not stalled, and we're making ourselves attractive to the research community. We still don't know definitively if CHAMP1 will have a treatment that helps every child, or it will require some individual approach. Um, so that's why it's so important to have your children represented until that question is answered. The reality also is when you have 200 known cases of champioid worldwide, pharma is not knocking on our door. The economics just don't drive that kind of attention that we want. So we've done everything, and we have to de-risk the involvement for potential partners to make it easy for them to say yes, to see potential, and to want to work with us. And that's what our foundation is doing every day. We're building infrastructure and momentum. So when science is ready, that we're ready too, and we're not stalling it. As I mentioned, these projects, both recent and taking place currently at our conference, you can imagine this gets extremely difficult to keep track of. Every champ in each study they participated, it becomes overwhelming, and we serve sort of as a community bridge between family and to researcher. One way we're trying to combat this issue of losing track of studies is to fill out the CRID, the unique identifier. In 2026, in the next few months to the end of the year, we're going to look to consent our families, so we can link your data with researchers and sort of streamline the efforts. That way, nothing gets left off and we don't lose track of anything. Um, all right. In closing, just the last piece of it was the animal studies. We've been able to, in the past, we had 5 different mouse lines and one rat model, which I'm really excited to see some of the updates from Edinburgh with Martine. Um, and this slide needs to be updated. We have 2 more, including a model from the University of Georgia, which is currently underway, and then Dr. Berto's model, which I'm sure he'll talk more about. So, guys, I know I shared a lot of information quickly. I tried to consolidate it into 10 minutes or so. Again, I'm devastated I'm not there with you guys. I hope you're enjoying the conference. I hope you feel empowered and you want to get involved. And I want you guys to know that every day that this foundation is fighting to make the lives of CHAMP1 children better. Again, have a wonderful time at the conference, and I look forward to listening in.